we are now joined by 9 Short Months' by Wendy Pinter from 9 Short Months Birth and Community Wellness Center on the Megacast. Wendy, welcome to the program.
Thank you for having me.
So first off, how are you? How's your team? How's your family doing during all of this?
Well, everybody is safe and healthy right now. I appreciate you asking. My team is tired. I would definitely say that that is a good way to describe how things are here.
And so for those unfamiliar, what does 9 Short Months do? What services do they provide?
We provide full scope prenatal care. So people come here for their prenatal care while they're pregnant, and then they actually will come and deliver at this facility as well. We offer a natural birthing experience, including water birth. Our beds looks like a bed and breakfast in here that you give birth in. So this is kind of giving people the home birth experience, but not at their home.
So dealing with expecting mothers, prenatal care, it's got to be a hands-on service that's being provided to these families. And COVID-19, obviously, it's going to have a huge impact on that. So what are some common deficiency of services for mothers, either from doctor offices, from services like yours possibly, or needs and challenges that have arisen during the pandemic?
It was quite a challenge right from the beginning. I would say before the pandemic started, we had a volume of probably 3 to 5 births a month. It wasn't really a super high volume. So all of us really worked part-time. That was what we were used to. Come around March 15th, 16th, I started seeing people calling me on Sundays, and it got to the point where we were getting 25 calls a day from new moms. And one thing that has been interesting about this, I'm not really sure what other offices are doing, but we're getting a lot of emergency calls from people who aren't able to get a hold of their healthcare practitioner. Right when everything shut down, I think prenatal care was still considered a essential service, but everybody went right down to telemedicine, ourselves included. And while that was appropriate at the time, I think, some people have fallen through the cracks. Even in our practice, we probably missed some things that we should have been on top of just for the fact that people weren't coming into the building anymore. And another thing that we had, I'm glad that we're doing it, but we've adapted a model of actually doing drive-through prenatal appointments for people. This was something that we learned by talking to other birth centers nationally. We all got together right when this happened and came up with some best practices. And that concept was really hard to sit with, and it was really awkward for everybody. We would be in full gear and then go out to the car, and we would just shrug and laugh and cry, because we are used to sitting and talking to people, and here we are passing them the Doppler to check on their own baby's heartbeat in their car. And this week I started getting annoyed with it, just like wanting to relax those guidelines a little bit that we had come up with to protect our space. In the past 24 hours, we've had 4 babies that have come through here. And so we really need our space to be very healthy for these, individuals that are coming in to give birth. And I was just like, can't we just have people do their prenatal care like normal again? And 2 of our people that showed up yesterday had fevers in their car, so they didn't come in the building. And I was like, okay, I guess it's not time yet. We're not ready to totally get back to normal as much as I want to rush it.
And so with that, parents are cautious. They should be cautious, and it's got to be affecting your business to have that kind of caution out there and have all these different threats out there to the health and safety of your clientele and of course to your staff as well. So Wendy, what precautions are Wendy Pinter, of course, from 9 Short Months Birth and Community Wellness Center. What precautions are you and your team taking to kind of ease those worries and to help keep your facility, to keep your staff, and to keep, of course, your clientele safe as we continue through this process?
I've had to hire a bunch more people so that we can work essentially on 2-person teams, so that if somebody does get exposed, whether it be here or outside of here, that they don't take out the entire workforce here. And it's not easy to find people that are skilled in this, but I've been very fortunate to put together a really good team. And as most healthcare facilities, we get stretched thin, especially when we're busy, and we are busy. I'm happy for that. That I wish it didn't take this for people to understand that this is a really great option for giving birth, especially if you've had a baby before. These people are they're having a great experience, but it's kind of, we're taking it really seriously. I don't go anywhere except for here. I don't even go grocery shopping, and I expect the same of the people that I employ. So we are really sacrificing, like, even seeing our own families in order to keep our patients safe.
And so even beyond that, with social distancing measures in place that you're taking, you're trying to avoid having people come into your office, like you said earlier, that are having a fever or aren't feeling well in any way, shape, or form. You even mentioned you're doing drive-through care as well. Have you engaged in telemedicine for these expecting mothers, and what are some challenges with that potentially that have arisen?
Well, I think the challenge is that all of a sudden, in order to do telemedicine effectively during pregnancy, people also need to buy equipment like a fetal Doppler or a fetoscope, which requires some skill to use. They have to have a blood pressure cuff. And without those things, we're just talking to them, which there's a lot of value in that. And we do spend about an hour with each of our patients when we do a telemedicine visit. So I feel like we're getting a pretty good range on things. But somebody can look fine and be quite sick. So that's the challenge that we have. And I think we're seeing some stories about that coming out nationally, that some things are being missed, especially in the pregnant population, by doing primarily telemedicine. And I can definitely see that evidence in just the random phone calls I'm getting from people who aren't getting the type of care that they might need for the situation they have.
So you said your team at 9 Short Months Birthing and Community Wellness Center has delivered several babies already just this week. In terms of the actual act of delivering the baby, especially in these times, and in regards to keeping the baby safe, obviously they're very young, their immune system hasn't developed. What's been changed in the actual process of delivering the baby and in the immediate postnatal care as regards to the coronavirus?
Well, what I'm happy about is that in spite of how different our lives have become, and all of us have had a huge shift in how we behave, when it comes to birth, that's the same. And it's actually helped to keep me grounded, just to see how this process is still beautiful and natural. At first, I remember the first switch that I had, the woman came in I think it was on Wednesday, and she was pregnant with her 10th child and due any minute, and she gave birth, I think it was the Saturday right after. And I was just there myself, because I didn't know, nobody knew who was sick. And we made it very simple. She had a water birth. I wore protective equipment. I didn't hover over her. I don't even think that I needed to touch her. Like, the baby came out very easily. And after the birth, we did our standard, weighing and measuring, but mostly I kept the baby with her. And we usually do a home visit after, like, 24 hours after. to check on mom and baby. And instead, we have switched to just making sure all of our testing and everything is done before they're discharged. So they leave the same day, like 4 to 6 hours after the birth, and we aren't sending people to their homes anymore. And that is something I cannot wait to be able to get back to, because I think that's an important part of the care that we provide.
Wendy Pinter from 9 Short Months Birthing and Community Wellness Center, thank you very much for joining us today on the MegaCast. Best of luck and health to you, to your team, and to your clients going forward. Thank you for being with us today, Wendy.
Thank you. I appreciate it.
It's Wendy Pinter from 9 Short Months Birth and Community Wellness Center.